I'm sorry, did I wake you up? Oh my gosh, I'm so sorry. I just wanted to introduce myself. My name is Sarah. I'm gonna be your new nurse. Yeah, the other nurse is leaving. She's done with her shift, so I am taking you over. Yeah. Alright, so I just want to introduce myself. I'm gonna be taking care of you today. Yeah, can I get you anything, like any water, any food? Some water? No problem. I saw you already had a glass over here, so we'll go ahead and give that to you. Do you mind if I fix your blankets and pillows really quick? Yeah, you look like you're it's a little messy in here, so we'll fix that for you. All right, I'm just gonna sit right next to you here. Fix everything for you. Okay. So yeah, like I said, my name is Sarah, and I'm gonna be taking care of you today, okay? So I know the other nurse probably told me all this stuff, but I am gonna get you I'm gonna get some of your information. So I have my laptop right here. So what's your name? Okay. And why are you here? Oh no, I'm so sorry about that. So pneumonia? Okay. Well, I'm very sorry you're here. I know the hospital is not a fun place to be, but I will definitely try to make it better for you. And we're gonna get you better in no time, so don't worry. Okay. So I am going to start with a few examinations, okay? I just want to make sure that everything is going good in your body and that, you know, you're not getting worse or anything. So I'm going to start with a few things. It's not going to hurt or anything like that. They're pretty basic. So I'm just going to tie up my hair really quick. And we'll start on that. So how long have you been here? 2 weeks? Oh my gosh. Yeah, I know the doctor was saying that you might get discharged in a few days, so I will pray for that, right? Yeah. All right. Well, I'm going to go ahead and start with the vital signs, okay? So I'm going to go ahead and put on my gloves here. Are you warm enough and everything? Okay, good. So first thing I'm going to do is go ahead and take your blood pressure. I know you've probably had this done a lot, so I'm sure you're very used to it. But this cuff is just going to go around your arm and it's just going to squeeze it for a minute, okay? So do you have an arm that you prefer? No? Okay. Okay. And this is just my stethoscope, and I'm just going to place this over your heart so I can listen to your heart while I'm taking your blood pressure, okay? Your blood pressure is actually very good, very normal range. I'll go ahead and take this blood pressure cuff off for you. Set that to the side here, and let me just record your blood pressure so I remember it. Okay. Good. All right, so now I'm gonna go ahead and I'm just going to listen to your heart. So just your heartbeat. And again, I'm gonna use my stethoscope for that. Good, you're doing great. Great. So since you do have pneumonia, listening to your breathing is actually very important. So I'm going to do that next. But for this time, I'm going to go ahead and guide you in your breathing so that way I can hear it the most effectively, okay? So I'm looking or I'm listening for any raspiness, any crackles in your lungs, any fluid buildup, anything like that that would indicate that your pneumonia is getting worse, or the lack of those things, which would indicate that your pneumonia is getting better. All right, so I'm just gonna have you go ahead and follow me when I tell you to breathe. So I'm gonna go ahead and have you breathe in. 1, 2, 3, 4, 5, and go ahead and breathe out. 1, 2, 3, 4, 5. And again, breathe in. 1, 2, 3, 4, 5. And then breathe out. 1, 2, 3, 4, 5. Good. And now I'm just going to go ahead and have you roll over a bit so I can listen to the back of your lungs, okay? All right. 1, 2, 3, 4, 5, and breathe out. 1, 2, 3, 4, 5. Good. And now the other side. So I'm going to roll you over to the other side. 1, 2, 3, 4, 5, and breathe out. 1, 2, 3, 4, 5. Good. So we'll go ahead and fix your pillow again. There you go. Okay, you're doing so great. Your breathing is sounding a little raspy, or it does have a little crackles in it, but I wouldn't say that your pneumonia is getting worse by any means. I just don't think it's completely gone yet. So, yeah, that's why you're in the hospital. That's why you're here. So I'm not too worried. By the time you get discharged, all of that should be gone. All right. So now I'm just going to test your eyes. So I'm going to do a quick eye examination, and I just have this flashlight, and I'm going to have you go ahead and follow my finger wherever I move it, okay, with your eyes, not with your head. Make sure it's just with your eyes. All right, so we're going to start. So I'm going to have you look at the tip of my finger. Good. And go ahead and go up and just follow my finger. Okay, good. Well, give you a little break, and then I am just going to look into your pupils as well. All right, so just look straight at my nose here. Good. Very good. So your pupils look great, your eyes look great, so that's a good sign as well. The doctor did say that you had a wound on your arm. Yes? Okay, let me go ahead and look at that really quick. Okay. And I'm going to press on it and I'm going to have you tell me if it hurts or not. Does that hurt at all? A little bit? Okay. And does that hurt? Yes? Okay. Yeah, so I definitely feel like we need to cover that up. It's just open right now and I don't want it to get infected. So I'm gonna go ahead and grab my supplies to do that really quick. While I'm doing that, do you need anything at all? No? Okay, I will be right back.